general, something else that I also point out to patients is that for the most part, and we'll get into specifics, most IBD medications, for the most part, particularly the biologics, so the injectable type drugs, are safe to continue during pregnancy. So again, don't make any decisions without telling your doctors about stopping your Crohn's and colitis medications. Of all the medications that for sure we know needs to be stopped would be a medication called methotrexate. In general, over the last 10 years, there are fewer and fewer patients on this medication called methotrexate, but I'm very, very clear that this is not a medication that can be continued even while you're trying to get pregnant. And really everything else that's a biologic, that's an injectable, so drugs that you're probably heard of before, if not already on it, and I'm just going to give a list of them. So drugs called infliximab, different brand names, Remicade, adalimumab, again, brand name Humira. Some of you may recognize the name vedolizumab, brand name Entyvio, ustekinumab, brand name Celera. Again, these are all injectable drugs, and they have been shown in studies to be generally safe for pregnancy. Now, there are nuances to that. Some of the older biologics we have more information on. Some of the newer biologics that just entered the market the last 5 to 10 years, we have less information on. So this is a general principle. So this doesn't, again, replace the fact that you should speak one-on-one with your physician that's prescribing these medications. But I always say, as a general start, these medications are safe to continue while pregnant. And again, the only one that's not is the drug called methotrexate. So how do I know this? How do I know that it is safe to continue biologics? Well, first of all, if you think about the structure of biologics, these injectable drugs, we can be very reassured that they tend not to want to cross the placenta during the early part of pregnancy. And because they don't cross the placenta in the first or early part of second trimester, they will not cause what we call congenital anomalies. So for example, you hear about these scary things like a congenital heart disease or cleft lip, for example. Those developmental abnormalities happen in the developing fetus during the first trimester. And so when you're on biologics, the good news is they don't cross the placenta when the fetus is forming important structures. So that's something that you do not have to worry about. So in 2022 and soon to be this year, we will have a total of 3 other new drugs that I should probably talk about. They are not biologics, they are small molecules. So one is called Zeposia, one is called Xeljanz, one is called Rinvoq. And these medications, because they are new, we have very limited data on. They're all oral drugs. And for now, we recommend that women do not start them at the time that they are trying to get pregnant. So a very practical example would be if I have a woman in my clinic, I was thinking of starting them on one of these new drugs, but they tell me they're going to get pregnant in the next year or so, I would not start any of those 3 medications. Similarly, if I already had a woman on them, we would counsel about stopping them, getting them on another drug that has a safety record for pregnancy before trying to get pregnant. So similar to what I said about methotrexate, these 3 new drugs I would not use during pregnancy because we have very limited data.